Yes, friends, it's your boy Jacob once again. Now we are going to look at the career of clinical officers. What are some of the specialties you can take as a clinical officer to advance your career? Now we all know that doing medicine and surgery is the number one priority for all clinical officers, and it's the most justifiable route for all clinical officers to specialize and advance their careers. But what about if you cannot get into medical school? What other specialties can you take as a clinical officer? In this video today, we are going to look at the most top 4 specialties which you can specialize in as a clinical officer and then lead a very successful career with such specialties. One of the very good specialties we can think of is an ophthalmic clinical officer. Now, being an ophthalmic clinical officer is a specialty which is very good, where you deal with eye conditioning, diagnosing them. And this specialty is mostly in Ginger, where they study it for 1 year. Nurses can take it, clinical officers can take it. You come out with a diploma in ophthalmic clinical officer. Now, the jobs for being an ophthalmic clinical officer are quite very many, both in public institutions and private institutions. They can hire you in all these eye clinics in Mengo, all eye institutions. You work at outpatient, being the first online in all these eye condition, diagnosing them, then sending them to their specialists. It's a very good specialty if you are a clinical officer there and you are not going to do medicine and you are thinking of what thing to specialize in which can separate you from a crowd of clinical officers. I would think you would think on the side of being an ophthalmic clinical officer. Now, secondly, which other specialty can you take as a clinical officer to sharpen your skills and to set you apart from other clinical officers? Another I would think of is imaging. Radiography is a very good specialty for clinical officers. You can take it up at a degree level in Mengo. X-ray is a very popular place where most of the clinical officers study imaging, and radiography is a good specialty. The imaging centers are so many in Kampala where you can work, and also the jobs in public institutions paying very well. There are so many for being a radiographer, so you can go and study a 4 year degree and you be a radiographer specializing in CT scans, MRI, x-rays, doing all sorts of imaging and sonography. It's a very good specialty. If you're a clinical officer out there and you are looking for some of the best specialties you can take, I think radiography and imaging at a bachelor's level is a very good specialty for you. Thirdly, which other specialty can you take? Most clinical officers, those who want anesthesia, can go into anesthesia. Now, anesthesia had advanced from diploma to degree level. There are diplomas in anesthesia if you want to take them, but I would encourage you to do a bachelor's degree in anesthesia, which is available in Busitema and Kabale. That's a very good specialty for a clinical officer. It's a very good career. Being an anesthetical officer specializing in anesthesia, providing anesthesia services, both general and spinal anesthesia, is a very good specialty which you has never gone off market. There are so many areas in Uganda and other parts of the country where they need anesthesia services. Like in Kenya, they have anesthetic clinical officers and anesthetic nurses, where in Uganda it's all general, they are called anesthetic officers. So specializing in anesthesia as a clinical officer is a very good specialty. The jobs are still very many, despite the fact that the market is flooded, but also the jobs are still very many, both in the government and private as practice. So if you want to specialize as a clinical officer and you think of providing anesthesia services, I think anesthesia is not a bad course. You can either do it at diploma or degree level depending on your funds. Now, fourthly, which other specialty can you take off? there is no other better specialty than doing medical education. Medical education is at a bachelor's degree nowadays. So many professions, nurses, doctors do it. It's a very good degree. If you want to be an academician, you go and take medical education 3 years here in Mulago. Now it's at Makerere level. You get your bachelor's degree in medical education. That's a very, very good degree. You can teach in all schools. You can teach in nursing schools. You can teach in clinical schools. It's a very good specialty. You can specialize in all subjects of your preference, teaching at all these. There are so many schools now in Uganda where you can teach. It's a specialty which you cannot flop. You can teach in all these schools and still you can advance your career and specialize in some of those biomedical science courses. Like you can specialize in anatomy, you can specialize in physiology, you can specialize in pharmacology, and be departmental. Education is very wide, so if you choose to specialize and do medical education, you will never flop. It's a very good job which you can teach at university, you can teach at tertiary institutions. The schools in Uganda are so many which can hire you to take them lectures and teach your students. So medical education, if you are one of those who are interested in teaching and you feel you are a great teacher, you can go into medical education. So those are the most marketable specializations which you can take as a clinical officer. In case you don't get into medical schools, still you can lead a successful life with these specialties I've mentioned below. So if you have any other specialty you think of and you feel you want to share it with us, you can put it down in the comment section and we shall keep on discussing about it.